Welcome to the first of many, we hope, short presentations on snake identification in Australia. My name's Craig and my business is called SSSAFE, Snake and Spider Safety Awareness for Employees. You will notice that we've become partners on the site with Matt Hampton, who designed the site I think 6 years ago now, and it's up to 76,000 members, and it's also Maddie Hampton's birthday today, so congratulations Maddie. Jackie's behind the camera, she's my partner in this today. We do a lot of presenting. This is our first time doing Facebook Live, so feel free to give us feedback if there's any weird stuff going on or any orientation issues. I'm just going to step to the side and switch the light on just to illuminate things for us a little bit more. There we go. There we go. That'll bring up the snakes so they're nice and sharp.
So it feels like cans.
Feels like cans. We've been hiding up in the air-conditioned room before we come down here, which feels like, I don't know, the jungles of Borneo at the moment. It's been a really warm, humid day on the Central Coast. So what we're going to do today in this series of videos, we're going to road test the main species of snakes, and we're going to start off with a red-bellied black snake today, which is, I think, is a good place to start. It's, someone once called it somewhere a lovable larrikin, and I think that's a good way to describe red-bellied black snake. So we'll road test a black snake, and each time we go on live, we'll road test a different species. We'll talk about what a snake bite looks like, what a snake bite feels like, how a snake bite might unfold if you're unlucky enough to be bitten by a snake. And I think a lot of people are drawn to a page like this because, you know, maybe you're a bit nervous about snakes, maybe you're afraid of snakes, you want to know more, and you get onto a site like Snake ID. And not only is it a really friendly and open atmosphere, it's run by real hardcore professionals, particularly the ideas that bring all those instant or almost instant, everyone's got a different version of what instant is, but those rapid IDs to you. They do a fantastic job. I wouldn't dare want to be an ID. I think it's a high pressure job, but they are dedicated and they do a great job. So not only do people start to get interested in seeing snakes and being able to identify themselves by themselves, they see snakes in a different context. So rather than just seeing them as a dramatic thing on the news, you know, just triggering our fear response, we get to see snakes just going about their day-to-day lives, doing what snakes do, and we become naturally curious about them. So bringing the snake safety awareness component to the Facebook page, I think joins all the dots and completes the picture for everyone. So we will road test a snake today, and at the end of each segment we will go over the snake bite first aid. So these are the kits that we designed with our friends from Survival. We think they're the best kits going around. We wanted to make an improvement in snake bite safety, and after a lot of research and talking to a lot of people, we've arrived at these kits, which we are very proud of. But it's not good enough just having one in your vehicle. It's worth knowing how to use them. You don't want to be using a snakebite kit for the first time in a snakebite emergency, so we're going to take you through that. So I might get one of our charges out today. We're in my snake room, by the way. This is a modest little snake room where we've got a selection of Australia's most venomous snakes. And as I said, I'm going to start off with the red-bellied black snake today. Jackie actually might take the camera off the tripod shortly, but first up we'll just give you a close look. I reckon that they are absolutely spectacular snakes, and there's no doubt that they're up there as being one of the world's best looking or most handsome snakes. And this one's posing beautifully for us at the moment. How's the focal there, Jack?
Yeah, good. This
one's got a historic injury. It's got a little clip missing from a rib on the side there. Can't tell you what caused that. Could have been a shovel, could have been just about anything. And what people don't realise is that snakes are extraordinarily fragile creatures. I mean, think of them as a backbone, some delicate ribs held together by a bit of muscle and a bit of gristle. And they're very easily injured, they're very easily picked off by predators, and for that reason they spend a lot of time hidden away or just trying to avoid getting themselves into trouble. And fortunately for snakes, they don't need to eat a lot, so they can spend a long part of their life cycle hidden. And you'll see through the page, you get snakes turning up in all sorts of places. There's no end of surprises as to where a snake might turn up. Whoops, let's get him organised. All right, so I'm going to put this one on the ground, and Jackie's going to take the camera off, and we're going to zoom in. We would consider a red-bellied black snake as being dangerously venomous, although unlikely to kill you. You would think a child or an elderly person would be more at risk. And just notice how the snakes, a right angle is not a natural thing in nature, so when a snake comes up against a wall or something like that, typically they go left or right, they travel along the wall, they come to a door sill, they go under it, they go into a weep hole, or they go under a crack in the concrete, or something like that. So if you're thinking about how to make your residence a little less inviting for a snake to end up inside, I mean, in most cases you'd think it would be purely accidental that the snake gets in there. But if you're thinking of making it less attractive for them, just think about that. Think about having a proper door sill so the snake won't go under it, and think about blocking up some of the cracks where they might get in there. This one's moderately defensive for a red-bellied black snake, so you can see it's doing a little bit of flattening out. So that's usually the first sign. It's throwing its head around a little bit. It might even produce a mock strike where it actually lunges but doesn't open its mouth. If I kept annoying it, it might actually sink the teeth in and give me a dry bite, which is reasonably common with red-bellied black snakes. And when it's finally had enough, it will give me an envenomation. So I'll have, with a dry bite, I'll still have bite-like features. I'll have blood, saliva, puncture marks, the whole thing, but I'd arrive at hospital and they determined the bite to be dry. An envenomation would be a whole different matter altogether. And a red-bellied black snake bite is typically extraordinarily painful when they do actually envenomate. And I should point out that the pain or the absence of pain is not always an indicator of whether someone is badly envenomated. And we'll talk about this more as we look at some other snake species. But some snake bites will present as basically pain-free. But typically, if you're envenomated by a red belly, it's going to be a painful experience, but unlikely to be life-threatening. You can have some swelling, you can have some bruising, some bleeding abnormalities, and you can be a very sick puppy indeed. In fact, I know of a couple of snake catchers that have lost their sense of taste and smell as the result of serious red-bellied black snake bites. But in many of those cases, when you look into them, you'll often find that the first aid has been delayed significantly, and that person has become fully envenomated or systemically envenomated and wound up in trouble. But people who get onto a snake bite early, that is, get the first aid in place, make that your number one priority, have very good prospects of coming out of a red belly bite quite well. Why are they so common? Well, they've got a wide diet, so they're eating a lot of lizards and frogs. Anywhere where you've got frogs and lizards, red bellies could be around doing quite well along the east coast, into Victoria, a little bit into South Australia, and some pockets of them in Queensland. But because of that wide diet, that's one of the reasons they've been able to do well in urban areas. And also they're a fairly relaxed snake, so they become readily desensitised to their environment. They get used to what's going on around them. They get used to foot traffic in parks, people on push bikes, vehicles going by. And after a while, they'll lay around in full view. And if you back onto a reserve or something like that on the east coast, you're probably quite familiar with red bellies. There's other snake species that are common as well, but they're a lot more cryptic, and we just don't see them as often. Let's see if this one will take advantage of the hide box. There we go. They're usually looking for somewhere to disappear. He looks happy enough in there. That's the kind of feature you don't want to reproduce around your backyard if you want to discourage snakes. But the smallest recess they can squeeze themselves into, the more comfortable a snake feels. And even a hide box that's much smaller than that, that red belly would squeeze into there. But think corrugated iron, plywood, tyres, rubbish dumps, material that's left lying around. It provides really useful habitat for a lot of snake species. Now, I did say a red belly is a reluctant biter, but if your dog's having a go at it or something like that, or you're having a go at it, if someone's trying to injure the snake, or for example they're trying to drag the snake out of a hollow log or something like that, a snake in that state will almost certainly bite. But a casual encounter with a red-bellied black snake is unlikely to invite a full-blooded bite. So you could probably pass by one, you'll get some sort of reaction perhaps, but you probably won't get a full-blooded strike. You might even get away with treading on them if you got off them quickly. This one's looking for a hide box again. If you've got any questions, fire them into the Facebook feed there, and I think Jackie can read them. If anything pertinent comes up, Jackie, you can bring it to our attention and we'll try and answer it. Alright, so I'm going to put that one away now. The lovable larrikin. One of my favourite snake species. A close relative of the king brown. So if king browns right across Australia, or mulga snakes are related to this guy as well. Well, that's a little close for comfort. Let's organise that. And we'll organise our little temporary hide box. And we'll whip them into there. How are you going for temperature, Jack?
Good.
Alright, well the snakes are loving it, that's for sure. It's definitely over 30 degrees in here. Alright, what do we do if we are bitten by a snake? The first thing you want to do is reach for your first aid kit. Have it close at hand. It's no good if it's left in the vehicle and you're 200 or 300 metres from the vehicle and you found out that you've been bitten by a snake. Venom, when you are bitten by a snake, typically the bite is going to be a shallow puncture mark into the tissue there, and your lymphatic system is going to clean up that venom. It's going to move venom close to the surface of your skin. So the first thing we want you to do if you're bitten by a snake is stop and drop. That is, put yourself at rest. If you are active, if your lymphatic system, if your muscles are contracting, that's going to push your lymphatic fluid along, and the venom's going to arrive in your bloodstream a lot faster, where it's going to do the damage. Most people know that you need to keep people still and you need to put some sort of a compression bandage on. But what the science is telling us is that people struggle to get the pressure as firm as it needs to be. Any bandage will do, provided you can create firm pressure along the entire limb. We love our smart bandages, of course, because they're an elasticized bandage, so they're stronger than the average, and they give you a visual cue, an indicator to help you get that tension where you need it to be. So basically, we're just going to tension to form a square. So that looks all fairly foolproof, but there's a few pointers that you want to pay attention to when you actually put the bandage on. I might just get Jackie to come out the front here, just make sure you've got the orientation right. I'm just going to get something from over here. That's sorted. All right. So 95% of bites are going to happen on the extremities. They're getting people are getting bitten on the fingers and hands, feet and ankles. So more than likely you're going to be dealing with a bite on a limb. The first thing you want to do is take off any watches, rings, bracelets, anything that might cause a constriction. No constrictions there. I'm not going to wash the bite. When they get to hospital, they'll be able to take a swab of that bite and they can identify it. That will help them identify what snake bit them and ensure you get the right antivenom. All I'm going to do is take the smart bandage and I'm going to take it easily at first around the fingertips. So I don't want to crush the hand. If Jackie's got to wear this bandage for 2 or 3 hours, and that's not uncommon in a snake bite, you don't want to be crushing their fingers. So avoid the crushed handshake, go a little bit easier at the start, leave the fingertips exposed so you can monitor the blood flow to make sure that you haven't created a tourniquet effect, and then we start to roll that bandage on. What I'm paying attention to now is I'm going to start to tension the squares out, and I'm going to roll the bandage on, and I'm going to pay attention to the overlap. It's a powerful bandage, so you don't need to overlap it around and round in the same spot. Around about 5 or 10 mil is going to be plenty. I'm just lining it up with the fine print, and that's giving me good even coverage. When you have a go at one of these, if you find you've run out of bandage by the elbow, it's too much overlap and it's going to be unnecessarily uncomfortable. As well as that, you're going to be reaching for another bandage. When I get to the top, I'm going to work my way down, just easily on the way down, and I'm just going to tuck that bandage in. So one bandage should easily do an arm, and 2 bandages will do most legs. So that's the second step. We've got Jackie immobilised. We're now going to splint the limb, and this part I love. You can use a sling, you can use anything really, but I love using a splint like this. It's more comfortable. It doesn't create pinch points, and you don't have to try and remember how to tie the thing and put it all on. All you need to do is roll this out. I'm going to pre-mold it a little bit on my arm. I'm going to sit you on there. Now ideally, of course, Jackie would be sitting down or lying down. I'm going to ask you to put one finger there. I'm then going to take the crepe bandage out. So if you only had a crepe bandage, you could do it with a crepe bandage, but you're going to have to wind that thing on really firm. All I'm going to use this crepe bandage for is just to attach the splint. I'm pretty happy with the squares that we've made there, so I'm not going to go any firmer with this bandage. I'm just going to lock that splint in to keep the limb from moving. Some of you might be thinking, righto, I've done a terrific job with the bandage. Now I can walk my way to the car, or I can march myself out of the gully. The answer there is unfortunately no, you cannot do that. Once the victim starts moving, once they start exerting themselves, they will stimulate the lymphatic vessels, and it will override even the best done bandage, and Jackie would find herself envenomated. Where do I keep the limb? I keep it below the heart. So intuitively you think you want to have most injuries above the heart, but with an envenomation you want to keep it below the heart so that you're not draining those lymphatic fluids. Inside the kits you'll find a little permanent marker. So we're going to mark an X on the spot where we think the bite was. And really, anywhere from the elbow down, I'm going to start at the end of the limb and I'm going to work my way up. If Jackie was unlucky enough to get a bite in the upper arm, I'd probably go from the top down. It's not necessarily wrong, but it may be unnecessarily uncomfortable. So wherever possible, keep it simple, start at the end of the limb and work your way all the way up. Same with the leg. If it's from the knee, anywhere from the knee down, start at the toes, work your way up, bind the good leg to the bad leg, and keep them nice and still. That's probably a video for another day where we'll treat a leg. That should do it for now. Inside the kits you've got an instruction card for in case the mine goes blank, which you know it can in an emergency. So you've got an instruction card there, and then while you're waiting for the ambulance, you can flick that over and you can take some patient history. So are they on any medications? Have they been drinking? Anything like that is worth knowing. And it's also useful to know the time of the bite and the time the bandage went on. That's going to be useful at the other end for the doctors. How does that feel? Good. Yeah? Firm? Yep. I mean, it's not uncommon to feel some tingling, some discomfort, because you know you are physically impacting on the lymphatic vessels. You know, you're squeezing down on them. The main thing we want to know is, do we still have vascular return? So when I pinch the fingertips there, they go white. The colour returns, and that is good news. That means I haven't cut off the circulation and created a tourniquet. But guaranteed, if you're going to wear that for a length of time, it is going to become uncomfortable the longer you wear it. But that is the reality of being bitten by a snake. You'd rather put up with that discomfort than have the venom travelling through your system. How long does that buy you if you are bitten by a snake bite? Is it going to, you know, it's not just 15 or 20 minutes. If you're bitten by a snake and you get the bandage in place early, it's reasonable to expect many hours of symptom-free management of that snake bite, provided you follow the basic rules of immobilisation and pressure with the bandage. So pressure bandage plus immobilisation. All right, well that just about brings us to the conclusion of our first presentation. Feel free on the Facebook page to suggest topics as they arise. Next week we're going to look at a tiger snake, and we'll just work our way through the species. If you came in late and you missed the first aid component, we'll make sure we do that again. We'll do that actually every time that we do one of these presentations, because I don't think you can learn too much about snakebite safety and first aid. Jackie, have we got any questions? I know there was one question that came through earlier, and somebody was asking me, I think it was Corinne, she said she's a registered nurse, and is it worthwhile carrying a bandage wherever she goes and throwing one into her first aid kit? Which I would say a resounding yes to that. And really, you would kick yourself if you are going into the scrub or you're going into you know, open paddocks or somewhere like that, and you don't carry a snake bite bandage with you. If it's good enough to carry a water bottle or something like that.
And have communication as well.
It certainly was having a snakebite kit or a bandage with you. Some of the things we like about the kits, you know, if you're into camping and hiking, you can attach them to your belt or your backpack. They're basically waterproof. They're very robust. None of the contents expire, and so you know you can have one of these for years and years and years. But I do urge people to learn them, practice them, get your kids to have a go, show them how to do it, get them to show you how to do it, and just bear in mind if you are dealing with a child, and that's probably another topic as well. If you are dealing with someone with a fine arm, so a child or an elderly person, somebody with low muscle mass, just go a little bit easier with the bandage, a little bit easier on those squares, just for the fact that their arm's going to be it's going to be easier to get those pressures. The bandages are designed to capture the middle section of the population and get you up into that higher thresholds. All right, well look, we love, once again, we love the page. We love being on the page. We love the way the page is changing people's perception, their feelings towards snakes. Instead of being frightened about snakes, it's igniting a natural curiosity. We love the way that the snake page is getting the conservation message to a much wider audience than might otherwise have happened. And we really do love the way the ideas and the dedicated people that work behind the scenes to make this page a really family-friendly, educational, fun page to be on. If you are interested in any of the stuff, any of the kits, Maddie will put something up later. There's a discount code that will come up, and Maddie also might put up some ID features and something to accompany the red-bellied black snake.
Okay, I'm just looking at...
That's just checking out if we've got any other questions coming our way.
Okay. Just asking how to get on.
Well, I'm not the person to ask for that. If you're on Snake ID Australia, also jump on and join our SSSAFE Facebook page as well. We share ideas, and there's lots of interesting posts, educational posts that are going to be popping up on that page as well.
Okay, so one of the questions is a spiral more effective than a figure eight?
Is a spiral more effective than a figure eight? And that's not the one bottle I'm looking for, that's an old one. I'm not exactly sure what you mean by that. I'm just looking at getting a nice even tension with the bandage and just getting a slight overlap with that bandage, so I just get nice even coverage. Some people with other bandages might start at the bite site, go around, down and up, but we've intentionally designed the Smart Bandage so that you just need to do it the simplest way possible, and that is start at the end of the limb, work your way up. The critical thing, in my view, is don't crush their fingers and their toes. Don't unnecessarily put that pressure on those sensitive parts, because who knows how long they're going to have to wear it.
Sarah's asking, what if you need to hike out from where you're bitten? It looks like somebody says hike out.
Mm-hmm. So I'm calling that risk management. And a lot of our work is talking about risk management with companies and people that have workers outdoors. Now, if you work for a company, you'll have some sort of risk management in place. If you're just going out on your own, you're also doing your own risk management. So if you choose to go without a communication device, or if you don't have a snake bandage or something like that, you are taking a greater risk, and it depends what level of risk you're exposed to. But to answer the question, if you are bitten by a snake in the field and nobody is coming to get you, or nobody knows that you are out there, you have little alternative other than to try and find your way out of there and get help. Keeping still, putting a bandage on, all of that works, but eventually the venom will start to work its way through. So in these days, look, it's hard to get lost these days. There's lots of different ways you can communicate.
Preparation.
There's your phone,
Yep.
which is good in most situations. There's a decent GPS unit, like a Garmin or something like that. There's EPIRBs. There's all sorts of ways you can signal an emergency and get yourself out of stride. And when you think about it, snake bites that go wrong in this country, you will usually find not managing time and not managing the logistics are one of the key features of things going wrong. So people getting bitten in remote areas and delaying the first aid, or just not being able to get themselves to the emergency services.
Megan's asking, could you use the smart bandage on a dog if they're bitten?
You could, and it has been done. Tricky with a dog because they're busy and it's hard to see what's going on with their fur as well. But lots of dogs get bitten on the face, unfortunately, because they've got their head down there. But if you do have a bite to the limb on a dog, you definitely can put a bandage on it. The best thing you can do with the dog is try and get it as quiet as you possibly can, and you might benefit by confining the dog, putting it in a crate or something like that, so it's unable to move around easily. But yeah, it works the same way. It compresses the lymphatic vessels and slows down the spread of the venom.
MAD Exotics and Reptile Care says, does aspirin make a difference to someone if they're bitten and on medication for thinners?
If somebody was on blood thinners or aspirin, that would definitely be something you'd want to note, because many components of snake venom cause a thinning of the blood through various pathways. People can end up with thin, watery, unclottable blood, and if you already have that as a baseline, you can imagine that that's not a good starting point.
Walter Adam is asking, are there any recommended identification courses for a practicing ecologist to hone his ID skills?
There's nothing better than snake identification in Australia, because what it honestly does for you is it just keeps throwing up all these variations at you, and there's no, look, I've had my 10,000 hours of staring at snakes, so when I look at a snake in a situation, I go through a quick mental checklist and I arrive at something that's probably close to right. And the more you look at them, the more variations you see, the better you'll get for just being able to look at a snake and get a feel for what it is. Because let's face it, some snakes need to be formally identified by scale counts, and nobody's getting close enough to do a scale count with a live venomous snakes. If you turn up a snake skin, yep, you can count the scales and you can ID it that way. But there's no substitute for just repetition, just looking at them. And what you're noticing if you are on the site is the variability, particularly ground snakes and tiger snakes and the like.
And Jackie asks, if you're bitten on the hand, once bandaged, do you sit the patient up to have the limb lower than the heart? I think you answered that.
You want to work with gravity, and that is keep the affected limb below the heart. Sit or lie down, which is ever comfortable, as long as the victim is at rest and not exerting themselves. Akari's
asking, I'm sorry if you already mentioned it, why does snake venom enter the lymphatic system first rather than the blood?
When a snake bites you, the chances that the fangs are going to enter a vein, as in an intravenous injection, are very slight. There is a small possibility that could happen, but more than likely the venom is going to be deposited just beneath the surface of the skin, into the tissue, and your lymphatic system is going to clean that up. So when you graze your knee or something like that, as a kid, and you get all that white fluid around it, that clear fluid around it, that's your lymphatic fluid. So often the first indication of a snake bite is tender lymph nodes. The venom travels, it gets to the lymph nodes in the armpit, for example, and people feel tender lymph nodes. At that point, it's entering the bloodstream.
All right, I think we've answered all their questions.
Excellent. Well, thank you for attending. I hope it was informative to you. I think we've got the system worked out now and how to work this technology. And next week, or I think it's a fortnight's time actually, Maddie Hampton will notify you when the next one's coming up. We'll keep the date to a Friday evening at 7:30. I think that's a good time when people are relaxing, and we'll keep them short and sweet. Thank you, and have a good evening and a great weekend.
And happy birthday, Maddie.
Happy birthday, Matt.